Hi, my name is Kelly Ormerod and I'm a health science student at Charles Darwin University. I want to begin my recording today by acknowledging the Larrakia people, the traditional custodians of the land on which I am recording. I pay my respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples. Hi Clint, welcome to our muscle testing today, our session. First of all, I just want to give a brief history of your medical history. So, 40-year-old male.
Yes.
Any injuries, medications, health conditions that we need to know about before we move into this?
No injuries.
Great, okay. So today with manual muscle strength testing, we are going to look at three different joints / muscles. We're going to look at the shoulder joint and the anterior deltoid muscle. We're going to look at your knee joint with the quadriceps femoris muscle, and we're also going to test your ankle joint with the tibialis anterior muscle. How does that sound?
Sounds great.
Yep, so it's a good broad range of your whole body for our testing today. Now, I just want to make sure that you're happy for me to maybe place my hands on your body at some points during the testing. Because we need to palpate the muscle sometimes, and sometimes we need to stabilise the muscle, and then other times we actually need to feel that that muscle is contracting when we're testing it. How does that sound?
Yeah, that sounds fine. I have no issues with that.
Awesome. All right, so just a bit of history on muscle strength testing and why we do it. It's a really great tool to assess symmetry in muscles, function in muscles. It can pick up weaknesses, compensations. It can also sometimes identify neuromuscular conditions, which is why we do muscle strength testing. When we undertake the testing, sometimes I might ask you to move against resistance of my hand, and additionally, in some instance, I'll be palpating a muscle to make sure I can feel that it's contracting as it should. So for each different test, I'll give you instructions, and if at any point you feel any discomfort or it's hurting, please let me know, because there shouldn't be any pain, and we'll stop immediately and reassess what we're doing.
Okay, yep, no
Great.
worries.
Thank you. So as I said, when we do the muscle testing, I'm going to have to apply pressure, and generally it's always optimal that when we're testing the muscle, we're putting it in a position where it's working against gravity. So sometimes it may feel difficult to do the movement, and that's one of the things that we're grading it on. So that's totally normal if you feel like there's a weakness there. The other thing, this is known as the optimal test position, which we'll always try and do in our muscle testing.
Yep.
We're also going to be using a thing called the Kendall Muscle Group grading scheme, which has a numerical value. And the numerical value is between 0 to 5, with 0 being you can't actually move that muscle, to 5 being you can keep your muscle, you can move that muscle against resistance and hold it there. And then the scale works within that 0 to 5 framework. Does that make sense?
Yeah, that makes sense.
And obviously it's kind of a bit of a two-way street while we're doing the muscle testing, so please feel free to give me feedback while we're doing it.
Yep.
Great. Thank you. So Clint, before we start the muscle testing, it's really important that we do a warm-up to get your muscles warm, to make sure that there's adequate oxygen coming to them, and also to make sure that your joints are warmed up and you can do like full range of, well, you should be able to do best range of motion for your body.
Yep.
So we'll do dynamic warm-up, dynamic movements. That's the safest option instead of static stretches when your muscles and joints are not warmed up to begin with. So what I'll get you to do is just follow my movements. So you do them on screen. If I see anything in technique that needs to be corrected, I'll let you know. And if you've got any questions while we're doing the warm-up, please don't hesitate to ask. So we're just going to start first of all with some moving your head. So we're going to go look up, then we're going to look down, then we're going to look forward. Now you're going to put your ear to your shoulder on the left side, and then you're going to come up and you're going to put your shoulder to the right side. And then we're just going to follow that sequence again. So we're going to go down, and then we're going to look up. And then we're going to go to our shoulder again with that ear. And then we're going to go down to the other side. And we're going to look up. Now what we're going to do is just some gentle head swinging motions. So in an anti-clockwise or clockwise direction, we're just going to roll our head. And now we're going to stop and we're going to work it in the other direction. So just swap the direction that we were going. And keep going with that. Alright, so now we're going to move on to our arms. I'm just going to get you to swing your arms going forward. Please let me know if you feel any discomfort in your shoulders or when you're doing this movement.
No issues.
No issues?
No issues.
Great. So we're going to now stop and we're going to go in the opposite direction. So going backwards now. Perfect. Now what we're going to do is we're going to warm up our ankle joint by just doing a few dynamic little on your tippy toe stretches as high as you can go, and then down again, and then as high as you can go, down again, as high as you can go. Perfect. If you want, you can add your arms into this movement. So as you raise your feet, that's right, raise your arms. Just gets your body all moving. Alright, and now what we're going to do is some body weight squats. So this is a good one to waken up your leg muscles. It also helps move the joint, like your knee joints, which is what we'll be testing with your quadriceps today. So to do a squat, you're going to have your feet about hip width apart. Now, it's really important with the squat that you don't let your legs and knees travel inwards. You want to hold them out. You also want to push your butt back like you're sitting on a chair while you do this movement, and you're trying to get your thighs parallel to the ground. So we'll just start them slowly and then we'll speed them up. So squat down and just keep your chest upright with this movement. So you're trying to push your butt back, keep your chest upright. That's really nice how your knees are not falling inwards, they're tracking outwards. Also try and push up through your the back of your foot. And at the top you can even give your glutes a little bit of a squeeze to sort of turn them on and activate those muscles that are meant to be doing the work. Now we'll just speed this up a little bit. So if you want to start incorporating arms into the movement, because this will help to get your heart rate up, which is important for making sure that your muscles are warmed up. How are they feeling?
Yeah, warm.
You feeling warm?
Feeling warm.
Great. Alright, so this last movement that we'll do is to help warm up your hip flexor muscles. So you're just going to lift your knee up on one side, rotate it out to the side, and then place your leg down. You're going to do that again. You should feel this in your hip joint. It's a good one for your hip flexor. And now you can do the other side. Sometimes it might feel a little bit different on one side compared to the other side. That's normal. It's always important though that we warm up both sides equally. Great, how are you feeling?
Yeah, good, warm.
Alright, great. So we'll get started on the muscle testing now. Okay, Clint, so the first muscle that we're going to test today is the quadriceps femoris muscle. So there's a few things that, first of all, you're happy for me to touch. I have to touch your distal tibia and your top of your leg here to stabilise you, because we don't want your hip joint taking over with this muscle test.
Yep, that's fine.
That's okay?
Yes.
Alright, great. So this is a biarticulate muscle. It's quite a large muscle in our body. And what we'll be looking for is you'll be starting at a 90-degree angle with your joint, and then we're going to be going for a full knee extension. Okay.
Okay.
When you do this one, you're quite welcome to to hold onto the table to anchor yourself. We don't want you moving backwards when we do this test because it means that your hip is taking over. So this is purely testing this muscle, so that's really important. Now the origins of this muscle is that it's rectus femoris, the vastus lateralis, medialis and intermedius, and then the insertion point is the tibial tuberosity via the patellar ligament. So as I said, we're moving through a sagittal plane movement, and yeah, we're going to be extending your knee joint, so it's going to be going into extension. So to isolate the rectus femoris, as I said, I'm going to have to put my hands on your body, which you're okay with, and please hold the table so that we don't have our hip take over any of the movement. So with this in mind, we'll do both sides. I'm going to place my hand here and here, and now I'm going to ask you to do a full extension, and that feels like it's contracting really well. Just do it one more time for me, and I'm going to apply some resistance to this. And I can see that feels really strong. You're obviously able to hold against my weight of my hand. So I would grade that at a 5 because I saw no tilt. Did you feel anything in your hips take over?
No, nothing.
Alright, so I'm just going to do the same again on this side because it's important that we always test both sides. And again, I'm going to ask you to do the full extension of your knee. Okay, and go down, and we'll just do it one more time. And again, I'm not feeling any differences in strength. Both sides feel really strong. I would grade this side at a 5 as well. How did that feel for you?
Yeah, good, easy.
Easy, yeah, great. Thank you.
You're welcome.
Alright, Clint, so now we're going to go to do a test on your shoulder joint, which is a ball and socket synovial joint, and we're going to be testing the anterior deltoid muscle. So are you okay for me to touch your body to do this test?
Yes.
Okay, great, thank you. So just a little bit of a background on this muscle. It has an origin at the lateral third of your clavicle, and then its insertion point is the deltoid tuberosity of the humerus. It is something that allows you to flex at the shoulder joint, and it should be at a 90-degree angle when we first start the test. I'm going to give you instructions because it's important with this one that your arm is abducted. It is also then rotated and it's slightly anterior, so in front of your body, to make sure that we're not having other muscles take over with this test. While we're doing this, we want to make sure that your trunk and your scapula remain stable. So I'm going to be putting my hands in places to stabilize those muscles. So the first thing that we're going to do is we'll start with this side. Is we're going to abduct our arm. We're also going to rotate it, and we're going to move it slightly forward. This is the actual muscle that we are testing right here, and I'm going to apply resistance here while you push against that resistance. And that feels really strong. You've got no issues there.
No issues.
So again, I would grade that as a 5. Are you comfortable with that grade? Yep, okay, and we'll just try the other side. So again, we'll abduct, externally rotate, and then we're going to make sure it's just come forward so I can feel this muscle right here contract. And now you're going to push against the resistance. And again, that feels really strong. I don't feel any differences in muscle symmetry there. They both feel strong. How do you feel about that?
Yeah, that was easy.
Alright, great. So I'll grade that one as a 5 as well. Yep, okay, perfect, thank you. Alright, so this is our final muscle test for today. We're going to be testing, so it's on the ankle joint, and it's the tibialis anterior muscle. Now your ankle joint is a hinge joint, and basically the tibialis anterior is very much responsible for allowing dorsiflexion to occur and plantar flexion as well. So the origin point of this muscle is the lateral condyle and upper 2/3 of the lateral tibia, which is this front bone here. And then we've got the insertion, which is the medial cuneiform and base of the first metatarsal. And this action is, we're going to start in slight plantar flexion. I'm also going to get you to invert your foot, and we're going to have your hallux in flexion as well. So it means you're going to scrunch up this toe. Now I'm going to hold my hand on your heel. Sorry, can I touch you before we? Sorry, I did forget about that. Now I'm going to hold your foot on your heel. I'm also going to hold on the dorsal and medial part of your foot. And with you starting in plantar flexion with your hallux flexed, you're going to dorsiflex and invert at the same time. Yep, okay. So when I feel that, and I don't know if you agree, you're capable of doing it, but you're not as strong as your other muscle contractions. So I would grade that at a 4 as opposed to a 5. Do you agree with that? It feels slightly weaker?
Yeah, I do. I agree with that.
Okay, great. Now we'll try the other side now. So I'm just going to, again, if you're fine with it, touch your foot again. I'm going to hold the medial and top part of your foot and your heel. When you start in plantar flexion, that's it. Invert and dorsiflex. Yep. I actually feel like this side felt a little bit stronger. Is this your more dominant side?
It is, yes.
Yeah, I would actually give that a 5 and that a 4. It just felt just slightly stronger, but not so much that I would say there's like a marked weakness on this side. All right, great. Did you have any questions about this one?
No.
All right, great. Thank you. Alright, so today we've done your muscle testing today. To recap, we did the shoulder joint with your anterior deltoid, we did the knee joint with your quadriceps femoris, we did the ankle joint with the tibialis anterior. They were all quite strong and we didn't have any issues with muscle symmetry. We did kind of notice with the ankle joint test with the anterior tibialis anterior, that it was slightly weaker than the other two muscles.
I agree with that,
Yeah, we agree with that. But again, it was still strong and you were still capable of holding against resistance. It just wasn't like blown away by the power of it. So that pretty much concludes our testing today. Thank you so much for participating and allowing me to do the testing. Did you have any questions or feedback?
No questions.
Okay, great, thank you. Hi, this is part B of my assessment, and I've been allocated the worksheet that relates to the core, lumbar, pelvic and hip complex, which have all been connected to lower back pain. Before we begin, I'd just like to make note that this tests in this section differ slightly from the standard limb muscle strength testing. According to Kendall's muscles, the highest test movement grade achievable in an anti-gravity position is grade 3, fair. However, the muscles of the trunk, such as the abdominals, lateral flexors and back extensors, these are the exceptions to the rule of muscle function, as primarily they act more so like stabilizers than prime movers. So therefore, today with my worksheet and my verbal defense, we're looking at the endurance capacity of them, how they activate the sequencing, and we'll be evaluating them based on this rather than resistance grading. And please keep this in mind because it underpins the whole rationale for each test that I am discussing today. So lower back pain is one of the most prevalent musculoskeletal issues in the world, affecting almost half of working age adults. The spine's ligamentous structure, so it's quite fragile, alone provides very little stability, and consequently the muscles supporting the spine play a vital role in maintaining posture and protecting us from injury. Before doing any core or trunk testing, it's vital to check first that the deep local stabilizers, including the transverse abdominis in the anterior and the multifidus in the posterior, are properly coactivating and stabilizing the lumbar segments before limb movements occur in the tests. So, aligning with the purpose of the lower back pain assessment, all tests being discussed aim to identify deficits in core activation, endurance, and lumbopelvic control, which are known contributors to chronic back pain. Hello again. So my assessment series began first by confirming that the transversus abdominis and multifidus, which are both stabilizer muscles, were functioning correctly in relation to ensuring spinal stability. The transverse abdominis is located within the deepest abdominal layer. Its origin is the lower 6 ribs in the cartilage, interconnecting with the diaphragm muscle and thoracolumbular, as well as the anterior of the iliac crest and lateral part of the inguinal ligament. Its insertion is the linear elbow and pubic crest. It primarily functions to stabilize the lumbar spine during movement, flatten and compress the muscles within the abdominal viscera, and also provide some resistance when you're breathing out. It works within the transverse plane by drawing the abdominal wall inward, not outward. When it is weak, as shown in the image, there's bulging that's apparent in the abdominal wall. The multifidus origin is the sacrum posterior superior iliac spine, which is PSIS, and the transverse processes of vertebrae L5 through to C4. Its insertion is the spinous process of the second to fourth vertebrae, and its primary function is segmental stabilization and extension and rotation of the spine. And the plane it operates in is sagittal due to the extension movement. However, it does act isometrically during abdominal hollowing. So together, the TA and MF coactivate to provide segmental control. They also increase intra-abdominal pressure before limb movement occurs. And successful activation of these muscles is evident when the navel is drawn towards the spine during abdominal hollowing. And when this is occurring, you can palpate that movement under the fingertips. Once activation is confirmed, the assessment then progressed to to tasks such as leg extensions, unilateral leg extensions, and a bicycle extension movement, which introduced like controlled limb motion, which was evident with, and you could see that you could maintain lumbopelvic stability. And these movements help to determine whether the deep stabilizers can sustain spinal control under load, and reflecting the functional role of these daily muscles when you undertake daily activities. Research shows that people with low back pain often have a delay or failure in the transverse abdominis activation, suggesting that there's a loss of motor control as well as just weakness, and highlights that this is why it's important to take this lumbopelvic stability test first before doing any other testing. And that's why we started with this test today. It's widely acknowledged that trunk stability and abdominal strength is essential for partaking in all daily life activities, and therefore the 7-stage sit-up test, which is a valid test designed to assess the strength and endurance of the abdominal muscles through progressively challenging stages. The participants start in a supine position with their knees at right angles and feet flat on the floor. At each stage, the individual needs to complete one full sit-up following specific criteria, and the difficulty level increases as they progress. At no point during the test should their feet come off the floor. Scoring ranges from 0 to 7, with 0 being very poor and 7 being excellent. The 7-stage sit-up test is an effective way to assess abdominal strength because it challenges the trunk through both spinal flexion and hip flexion. During the test, the rectus, abdominis and obliques work concentrically to flex the trunk and lift it off the ground. And then as the movement continues, the psoas major assists by increasing hip and lumbar flexion. The hamstrings also help to keep the legs down while the quadriceps maintain the knee flexion. On the way back down, these same muscles work eccentrically to control the descent. When performed correctly, keeping the lower back flat ensures that the true abdominal strength is being tested and that there's no hip flexor dominance, which means that as long as they're doing it correctly, it's a reliable measure of strength. Overall, it provides a functional measure of trunk strength and control, which is relevant to everyday movement. And additionally, a study by Bay et al. 2018 found that frequent sit-up exercise improved individuals' pain level and functionality, reducing the symptoms of lower back pain as it strengthens the rectus abdominis and obliques. So they used in their study the 7-stage sit-up test because it was recognised as a valid way to assess functional abdominal strength. And it's a methodical way to challenge the muscle groups within the core and also protects against your hip flexors taking over. It is important to note, though, that a study by Strand et al. 2014 did say that sometimes the validity of the 7-stage sit-up test can be reduced because if fatigue sets in, increased hip flexor activation can occur, which creates lumbar stress due to poor form. So it just highlights the need that this test needs to be undertaken in controlled conditions. So the next test we did was a plank exercise. The plank is recognised as an excellent assessment of abdominal endurance, while also offering a lower risk of causing back injuries or making back injuries worse due to it engaging core stabilizers rather than spinal flexors. During a plank, several major muscles work together to stabilize the body. The rectus abdominis helps keep the trunk steady and supports spinal alignment, while the transversus abdominis acts like a corset, tightening around the waist to protect the lower back. The pectorals in the chest and the serratus anterior around the shoulders help maintain the upper body stability, and the trapezius and rhomboids in the upper back support proper posture and shoulder positioning. All these muscles work isometrically to hold the body in a straight, stable position, thereby testing just the abdominal strength and endurance. Once the abdominal flexor strength is established using the sit-up test, the plank test is then really good for assessing the endurance of these muscles in a reliable and valid way, which was found by a study by Strand et al. Furthermore, this same study found that the static position of the plank reduced tester bias because compared to the repetitive movement of the sit-up, which can create lumbar strain as your body fatigues, this movement, the static nature of this movement, it makes it a little bit more, increases the reliability of the test because there's less that can go wrong with fatigue. This same study was able to develop normative data, which is easily applied when conducting this test for both healthy males and females. And a separate study was able to also produce normative data for those who had back pain already. So the availability of norms for the plank testing make it a practical way to undertake abdominal endurance, and the results are easy to interpret as it's a timed test, so therefore it improves its validity as a muscle testing exercise. Pelvic stability is achieved through activation of the gluteus maximus during hip extension, with delayed activation found to compromise pelvic control and contribute to lower back pain. Therefore, the prone hip extension test has been identified as a valid measure where the tester observes if the gluteus maximus contracts first during leg extension or if the hamstrings activate before the gluteals. Extension is within the sagittal plane with the posterior movement of the thigh relative to the pelvis, raising the leg backwards while lying prone on the ground, typically allowing for just 10 degrees of movement. During this action, the gluteus maximus should initiate the move, which is then just supported by the hamstrings to complete the extension. The gluteus maximus is the primary hip extensor. It's responsible for powerful movements such as climbing and running, and it also contributes to lateral rotation and pelvic stability through the iliotibial tract. If activation is delayed, the hamstrings and sometimes even the erector spinae often overcompensate, which increases lumbar loading, and this is what contributes to lower back pain. If gluteal activation occurs first, this will support the finding of efficient neuromuscular control and healthy pelvic stability. However, if the hamstrings or lumbar extensors observed visually and also when you palpate activate first, this suggests poor sequencing and over-reliance on compensatory muscles. This has been linked to chronic back pain. The test, therefore, is a valid measure which helps to in a simple way, identify faulty movement patterns, and therefore it can guide targeted strengthening activities to improve lumbopelvic stability. The trunk extensor endurance test assesses endurance of the back extensor muscles, primarily the erector spinae, with assistance from the latissimus and quadratus lumborum and trapezius muscles. These muscles are crucial in maintaining posture and spinal alignment. Also during this test, pelvic stability is achieved through activation of the gluteus maximus, which helps to prevent any back strain. In this test, the patient lies prone with their hands either positioned behind their lower back or head. The examiner stabilizes the legs and pelvis, and the patient extends their trunk up off the ground or table and holds the position for as long as they can with proper alignment. The duration of the hold is the recorded outcome measure, and the longer the hold time, that reflects the greater endurance and health of the lumbopelvic stability. Normative data suggests 210 seconds for males and 130 seconds for females to be within a healthy range. Because the test relies on a time-based measurement, it gives a valid and reliable indication of trunk extensor endurance. The objectivity also of a timing measure reduces test bias and allows for consistent comparison across multiple sessions, which therefore make it a practical and reproducible measure of spinal extensor health. Additionally, research has shown that individuals with low back pain exhibit a reduced endurance and possibly sometimes altered muscle activation patterns during this type of assessment. This has been found with the Beering-Sorensen test. So rather than relying on the lumbar extensors, these individuals tend to compensate with the thoracic paraspinals and hip extensors, which is shown to increase lumbar loading and contribute to ongoing pain. Therefore, people who have back issues are not advised to attempt this test.